My name is Jen Morrell, and I am honored to serve as the Managing Director for our newly established Ohio Center of Excellence for Behavioral Health Prevention and Promotion. We have an exciting presentation and panel for you lined up today. As you know, October is Medication Safety Awareness Month. And so we have lined up two very special panelists to share how their work has really impacted and leveraged the expertise in cornerstone that the senior adults have in communities and their family units. So Dr. Marketa Robinson is here with us from the Dayton UMADAOP program. And Dr. Jeff Neidig is a pharmacist and owner of the Medi-Wise pharmacy in Newcomerstown, Ohio. So he provides, he runs the pharmacy all day and is a few minutes late to this call. So we're going to go ahead and get started because he's probably tied up with a patient at this point. So
no, we're all good.
Jeff, you're here. Welcome.
Yeah, I'm there.
Gosh, just what everybody wants to hear when they join.
Yeah, no,
Thank you.
Thank you so much for joining us today. Before I turn it over to Tessa, she is going to moderate the discussion. I just wanted to share one slide with you about the Center of Excellence, since we are a new organization and we recognize there are probably several of you on the call who are curious about what we do. The Center of Excellence for Behavioral Health Prevention and Promotion we're facilitated by a team of faculty and professional staff at the Ohio University's Voinovich School of Leadership and Public Service, as well as a team of research scientists at the Pacific Institute for Research and Evaluation, often referred to as PIRE. So we exist to support individuals and their organizations who are providing direct prevention services in the community by promoting evidence-based and evidence-informed practices. But we really aspire to create that place where people and organizations can get connected, learn and grow from each other, embrace prevention science and incorporate it into their work, and then of course to advance health equity. So we strive to support the prevention providers such as yourself and the organizations you work for to network, to coordinate, to cooperate and collaborate in the spirit of creating innovative solutions to overcome challenges that we all commonly face as a community. So with that, that's why we're here today. So I will turn it over to Tessa to introduce our esteemed panelists, and really want just to let you know that this is a safe space. We want folks to connect and learn and ask questions. We'll have some breakout sessions later in the hour to give you a chance to do that, but we welcome any and all input from our participants today.
Wonderful. Thank you so much, Jen. And I really want to thank Dr. Marketa Robinson and Dr. Jeff Neidig. Thank you so much for spending time with us today. Each one of our panelists here today has a wealth of information around engaging older adults in medication safety practices, medication safety education, and engaging them with medication safety resources. So Dr. Marketa Robinson is the Executive Director of the Urban Minority Alcoholism and Drug Abuse Outreach Program for Montgomery County, or for Dayton, Ohio. She has a wealth of experience working across the lifespan in Dayton, Ohio with multiple populations. And I think her resources will really, and her insight will give us a unique perspective in looking beyond just the physical needs of our older adults, but also to those emotional and social needs that our older adults have that sometimes we overlook. Dr. Jeff Neidig is a wonderful pillar within his community in Tuscarawas County. So not only does he, by day, he is a pharmacist in Medi-Wise pharmacy. He's an owner of a pharmacy. He's also offers leadership in the independent pharmacy organization for Ohio, but also serves on the medication safety work group of his coalition, Empower Tusk. So his wealth of information comes to us from both the clinical perspective as well as that interprofessional and interpersonal perspective. So I think these two panelists together will be able to give us some really rich discussion and rich insight. So I'd like to invite both of you to introduce yourselves. In case there's anything I stumbled through or didn't represent perfectly, I would like to invite you to introduce yourselves. And while our panelists are talking through their experience and what they're excited to share with you today, I'd like to invite each of you to introduce yourselves in the chat. So we'd love to hear your name, and then also one challenge you're seeking to overcome as it pertains to medication safety in older adults. So while you guys are typing in the chat, I will invite both of our panelists to unmute and share a little bit about yourselves before we get into the discussion.
Good afternoon, everyone. My name is Dr. Marketa Robinson, and I'm the Executive Director of the Urban Minority Alcoholism and Drug Abuse Outreach Program of Dayton, which is also known as UMADAOP of Dayton. At our organization, we provide prevention, reentry, outpatient treatment services, and health and wellness to individuals across the lifespan. I've been the Executive Director here in Dayton since 2015. I really, really enjoy what I do. However, I live in Toledo, so I commute every day. But the pleasure of working in this field is my passion. And so the commute does not bother me. I just want to be a part of the team and help make Dayton better. I am a Dayton native. I was born and raised in Dayton, and I have adult children and grandchildren that lives in Dayton. And so I'm glad to be here to talk about some of the things that we do, working with seniors in prescription medication and getting that message out.
Thank you.
Great. Yeah. Again, thanks everybody for joining. It's really important. I think I love this slide. First 2 points are huge. Getting connected. That's really what my focus has been in Tuscarawas County. Jody Salvo is probably who a lot of you know from that area over our coalition, which used to be called the Anti-Drug Coalition of Tuscarawas County. But we've been doing so many things in other substances with marijuana and tobacco and alcohol. And now we've added suicide and now, of course, gambling in Ohio. So we've been doing a lot of things, touching a lot of different, we call community partners in our area, and just connecting with them and helping them understand the message and helping us share the message. Because if they keep hearing it from the same old voice, it's going to go blah, blah, blah after a while. So we just love that we're able to connect with other people in our community. I've been a part of the coalition probably over 10 years now, and am now the prescription drug committee chairperson, and just love the group that we're working with, and just all over different sectors, everybody getting connected. But yet we're not coming in as the experts. We're continuously wanting to learn and grow. And that's hopefully what everybody gets to do today is learn and grow. Please ask questions. Why in the world are you doing this, or why aren't you doing that? It's so much a way to get connected and exchange ideas. And I just love this format today. So hopefully we can have some good discussion a little later. So glad to be here.
Wonderful. Thank you both so much. I really appreciate it. I'm going to stop sharing just so we can have more of a conversation, and you're not looking at, I appreciate you referencing our slide, but I think, going forward, we're going to have a little bit of a conversation for a minute. And I just want to say, during both of your introductions, you alluded to the idea that senior adults represent a cornerstone of healthy communities. They're really a part of our healthy communities, not a separate population. I think sometimes we think of older adults as kind of being out here, and they're really a strong part of our communities. As you mentioned, Dr. Marketa, this is often an audience that is kind of forgotten and kind of tucked away.
Yes.
Can you share more about the opportunities that working with senior adults about safe medication use, storage, and disposal creates to promote prevention and impact community substance misuse issues?
Well, again, as you said, Tessa, and then I also noticed that Mary Wolf put in there, older adults have been that forgotten population, or they receive menial services. It's almost like they're missed. And from the research that I've done and data collection and focus groups, those individuals are just as much at risk as our youth. For the simple fact, due to age-related issues, due to health issues, because of the age, the loss of loved ones and separation, there's also some mental health factors that falls into play along with the medication. And so this population has been one that I have taken a strong focus to. to be able to not only educate on the medication aspect of it, but also on the embracing aging, as well as some of those risk factors and turning them into protective factors as far as dealing with aging in the aspects of addressing the isolation. So creating a level of more social connectedness and engagement of not only among their peers, but within their communities and different aspects, giving them the feeling of I'm still a part of life. Because a lot of times, and especially with the pandemic that has just occurred, that has been a significant impact, not only on our youth, but also on our older adults, because they are more limited due to maybe transportation issues, mobility, different things like that. So that isolation became even more intense.
Mhm. Yes. I think that thinking of those meaningful relationships for older adults is really important. And I know you've also mentioned a little bit around medication errors that are possible. When you mentioned aging issues, this definitely came to mind. Can you share a little bit about the medication errors that we discussed?
One of the biggest medication errors that I have ran into, and then I'll also later discuss some of the strategies that we have came up with to help them work through, is a lot of times, and this is not just an older adult thing, we get forgetful. So did I take my medicine this morning? I'm not sure. So do I take it and I've already taken it and then I've double taken the medication? I'm at an even higher risk for overdose. Or did I take it and I'm not sure, so I don't take it, and then I'm not addressing the medical issues that occur. And those are some of the biggest impacts that have really affected a lot of seniors. The other aspect of that is because most older adults are taking multiple medications for multiple health issues. Even having that understanding of the mixture of medication and that communication with the doctors of what medication you're taking is vitally important, because it can have an effect when the two don't work together.
Yes, it definitely can. Thank you so much, Dr. Marketa. Dr. Jeff, I know that we have talked about some of the opportunities in preparation for this call today. We've had a lot of conversations around the opportunities to work with older adults and what that looks like from sort of a messaging program, as well as how they fit into the sort of the continuum of folks that you're serving. I'd love to hear more about your experience with that and what that looks like for you guys.
Mhm. Yeah, I mean, our coalition, and probably a lot of coalitions and a lot of organizations maybe on this call, have always said, well, we're in prevention. We're just going to focus on the youth. But I know in some previous discussions with Dr. Marketa and you and Jen about, the older adults and this focus, it's bringing to light a lot of things that are there, but we're not really realizing. And that is the older adults need to be that example for us. They can't always be, because maybe they don't understand their medications, and we need to do a good job on the medication use component of that. But we need to work with all, older adults down to youth, because they all have an impact on the youth ultimately. So if we are only focusing on the youth and not touching the other components that can affect the youth, then I think we're doing ourselves a disservice. So, for example, when you're looking at medication use, it's very simple to say, okay, let's just talk to your pharmacist, which is true. They need to talk to your pharmacist. But when you're getting into the storage and the disposal, you really need to talk to the seniors that are handling that medication. Are they being a good example? If they're taking and able to take their medications correctly, are they being a good example to that? So those three messages, which are really common out there on many coalitions: safe use, safe storage, safe disposal, are very important in doing that. But you mentioned about messaging. Okay. So many times the older adults may feel that they have it all together. They know that, but there's still a lot of coaching, like Dr. Marketa was saying, that about taking them correctly, but also them being a good example to the families that they serve. So we were working with our senior centers and some of the groups that do touch those older adults more, and trying to get a messaging out there that would be pertaining to them. And we came up with, in our local area, and it's nothing trademarked, so you could certainly use it, called Mind Your Meds. we feel that in more ways than one, the elderly population need to mind their meds. And from what Dr. Marketa is saying, and what I'm kind of talking about from the them being the controller of the medicines, that is such a great message, I think, to get across to them, because they need to mind it in their own world of taking it correctly, so that when they do go to the doctor, they're being evaluated on medications they're taking them correctly. And then the standpoint of when they're minding their medicine, so that when others are in their home, they're seeing a good example of secure storage, medications not laying around that are outdated or unused, and it's just a constant messaging we need to get out, that the older adults play a vital role, and we just need to find a way to do that. What community partners are we using to get that constant message out to them of how important they are? Number one, as Dr. McKee was saying, about the safety issues in their lives, but also how they can control the access to some of the medications that are then misused and lead to abuse and addiction. So I think the messaging goes out, and that's where the community partners can come in. Don't try to be doing this all yourselves. I think it's very important to talk to those individuals. And I just saw the message that Mary put out there about Meals on Wheels. Who's in the home? Realtors, for example, need to know about medications in the home when they're selling homes, so that the drugs are secure. But who else is going into the home? Is their pharmacy delivering to them? Is Meals on Wheels delivering them? Who else can have the eyes and ears and the connections to them? And there's a lot of community resources that they need connected to. Home care, great idea. So community partners are essential to getting that message out, and getting the same message out, I think, is really important too. You don't want to have 20 people giving 30 messages. I think working through the coalition being the hub of getting that single message out, like what we did with Mind Your Meds, everywhere we go, senior picnics, senior luncheons, senior expos, it's all about that single message. Then behind the scene, of course, is the safe use, storage, and disposal. So I think, reaching out to the community partners to help you in their own way, in their own connections to those older adults, use them the best you can.
Absolutely. And thank you both so much for sharing a little bit about those unique opportunities. I know that, I feel like we've just hit the tip of the iceberg, and I know you guys have done so much work in this area. And a big part of that work has been collaboration. Would you each be willing to provide an example of partnership or collaboration you've participated in as reaching seniors with messaging around safe medication? And Dr. Marketa, I'll ask you to go first.
Okay. Well, one of the things that I found, our older population still has a strong faith belief concept. So there's a lot of engagement with the church. We have a strong partnership and collaboration with the church. Meals on Wheels, Wise, where they have the Y in Trotwood, where they have the silver sneakers. And we actually engage in those, as well as the senior day centers and the seniors living environments. And I think that is really important, because we're able to actually get to them as far as the engagement piece, get to them and reach out and interact. Some of the messages that we are sending, and one that I have found to be pertinent, like with a child, is consistency. Not only us being there consistently, but providing that information over and over consistently. One of the other things that I have found to be most effective, myself and with my staff, is because most older adults, I have lived experience, I'm wise, and I'm set in my ways. I'm not a kid, don't treat me like that. And so giving them the information and guiding them along, and being able to utilize the services. For example, when we do the disposal pouches, we actually have an in-person demonstration and have them walk along with us. One of the things that I found to be most effective is that pattern-based learning is really, really effective, because it doesn't require a constant memory concept. It's just a pattern of, I did this first, I did this second. And so that has been really, really helpful as far as feedback and individuals utilizing those disposal pouches and keeping that information. One of the other biggest messages that we input is it's not the mind your meds, but I really, really like that, Jeff. I really like that. Is that concept about protecting your medication, especially with the opioid epidemic hitting older adults often are prescribed opioid medications. And so family members and young individuals coming in and sneaking and taking their medications. So locking that medication up, protecting your medication is about protecting yourself. And that's where that safety component comes into play.
Absolutely wonderful. And I love the approach of working with older adults and just recognizing, like, yeah, it does. Sometimes we infantilize older adults and we have to provide that respect of, like, no, you do have life experience. You know, there are things we can share information back and forth, definitely. Dr. Neidig, we would love to hear from you about some of those innovative approaches to reaching the senior populations, you know, working across community sectors and how you build that comprehensive response.
Yeah, well, obviously you can start with your coalition membership right now, and maybe you need to expand it if you're having trouble getting into other sectors. But just that community engagement, big or small, connecting to them and who is touching the seniors. And the Mind Your Meds idea actually came from someone in one of our connections that actually works in the disposal and recycling area, and she does a lot of our messaging. And so the idea is it can come from those sectors. Number one is great, and then the connections with them is great as well. So the senior center has been a vital connection, and really the local library has been another good one. What are the seniors reading? How are they connected to the communities? So you can look at what organizations are connecting to them, but really finding out, maybe doing a talk at the senior center and finding out where do they get their information. Are they still reading the newspaper? Are they reading the library's newsletter? Are they getting the senior center's newsletter? And how can you get messaging out? So they've been great partners for us in just wanting information to put in their newsletters to go out. And I like this has been a big week for us in our county. So I gave a talk at the library on Monday night. So we advertised through the library of talking about safe use and storage and disposal for those partners. So I think, so I would say summary, first of all, take a look at your coalition, what sectors are there. And if you haven't touched the senior population, look at them with a different set of eyes, those memberships, and saying, how do they touch the senior lives? And then what are they doing now to be in front of those seniors with the in person or with certain messaging, and then partner with them. Because if they're a part of your coalition already, it's pretty easy that they want to be helping some way, probably with the youth or with other substances. It doesn't have to just be prescription drugs necessarily. But then how can they partner with you? I'm sure they'd love to. And then if not part of your coalition, look for those other opportunities that Dr. Marketa and I mentioned here. And hopefully we get other discussion open about who can you connect to in your community. Each community is unique, and each community needs to take care of their community in their own way. So how can you reach out to those other sectors to really bring them in and be another resource for you, so you're not doing it all alone?
Absolutely wonderful. Thank you so much for sharing. The next thing we have on our agenda is hosting a couple breakout rooms. But I did want to elevate, since we have a couple extra minutes, we've had enough time where, during our intros, we asked our participants to type their name in the chat and share something that they were interested in learning about today. So I wanted to hold a couple of those up to see if we could maybe, pick one or two for some discussion. So we do see, this isn't everyone's population, and that's great. And we appreciate you attending, even if it's not part of your population. Let's see here. It looks like recruiting and continual engagement is a bit of a challenge. If either one of you would be comfortable just in the next couple of minutes sharing, sometimes that recruitment is a little challenging, and I'm going to be honest. I didn't always have a lot of experience working with older adults when I started this work. So what is, a tip or a trick that you would share regarding recruitment or engagement for older adults, since both of you have been so successful?
Well, I think one of the biggest things for us is we targeted, like Dr. Neidig said, we targeted that population where entities were touching those individuals. And so that was a big, easy access. However, one of the things that we found to be most effective for continual engagement was one, food, having snacks or lunch, depending on the time of day that you do. Two, we also found that the social connectedness and engagement. So we do multiple components of alternatives tied into the education piece as well. So we make it fun, but we also do a component where we connect them with young adults and youth. And then we also do different activities such as line dancing, different things like that. I've suggested to my staff to kind of veer away from the bingo thing, although that is an attractor for older adults, but I did not want to put a new risk factor into the equation based on all of the things that was going on, especially with the gambling issues and how much it is more available. The other thing and most effective for us is just like youth in recovery, that peer-to-peer engagement is most effective. So two of my staff are actually peers of that older population. They really connect and relate. That has been beneficial. My experience that I learned from that is I went in with my staff, although I am a senior myself, but I went in with the staff and I started talking, and there was a lady, she pat me on the hand and she said, "Yeah, honey, okay, okay, go on over there and sit down." So I understood right then and there that that connection didn't make it as much as I wanted it to. But when I watched and observed the interaction between one of my staff member that is in his early 70s and one of the other staff members that is in her late 60s, there was a instant connection. It was almost like they were on the same mind wave. And so that has been really, really effective, not only for recruitment, but also the engagement component.
Yeah. And just a quick thing, I know you're getting to the next component of the talk, but she mentioned the doTERRA bags. And I think one of our unique partnerships was gained by having a distribution partner with these doTERRA bags. And Alice was on here a little bit ago. She's not on anymore, Alice Jennings, but we years ago we saw the kickoff event of theirs for their doTERRA bags, and just all what impressed me the most, and I still have that slide picture, the number of community partners that were helping distribute doTERRA bags. Such unique connections there, and that opens up a lot of doors. So just if you have a program, reach out to them, and they like the doTERRA bags, they can be great partners and starting to learn and get their foot wet and foot into the door of prevention, and then continue to knock on those doors and see how they can partner with you.
Absolutely. And thank you so much. The idea that if we have something for folks to snack on, if we can create those relationships, or if we have a tool I can put in your hand, that really does help. Because I think, especially as when I was new to prevention, I found putting something in someone's hands always made the connection more positive. It gave us something to talk about, something to engage over, rather than this prevention idea that was sort of in the air around us. So I love that both of you shared resources. So we have next on our agenda to spend about 15 minutes in some breakout rooms. So in breakout room 1, we're going to have Dr. Neidig, and this is really about connecting across the community. Dr. Neidig really talked a bit about and kind of alluded to their work with waste and recycling. And I think that would be a deeper conversation to have in that breakout room and see how, how we can connect with those infrastructure sort of organizations. And Dr. Marketa's breakout room will be centered on creating meaningful connections with older adults. So I am creating both of these breakout rooms right now. I'm also going to pause the recording at this time so you can all join your breakout room. You are welcome to share any key takeaways by chat, or you're also welcome to unmute and share any of those impactful pieces that you're going to take back with you for your work.
I know for me that I love the idea that Empower Tusk is looking at prevention as a big umbrella and then thinking about all of the things that can go into a prevention coalition, so that what we know are all those crosswalks between drugs, alcohol, medication, gambling, suicide, all of those things. And the more we come together around prevention messaging, where we're able to kind of almost stack messages together that give us that more empowering message, that's just such a great, using a coalition vehicle to do that is tremendously impactful for a community. So I think that's an amazing, I wish more people would understand how important coalition work is to your community.
Absolutely. And I love that phrase you use, message stacking, really making sure that in this comprehensive messaging, we're not competing, we're not competing across substances. We're not competing across work groups. We are building upon each other to weave this beautiful tapestry of prevention in our community. Absolutely. Thank you for sharing that, Mary. What other, pieces of the work that were impactful to you today?
I wanna touch base on something that Mary was just saying. And one of the things that I find significant in the coalition aspect is that it actually creates a level of collective impact, because you have multiple levers and multiple sectors working together as one to address the whole, and it's almost as, I can view it as the coalition, the main body is the trunk of the tree, and then you have all these different branches that are producing leaves. And so that was one of the things that came to mind when Mary was talking about the coalition and the impact that it can have.
Yeah, and I love that. I love that imagery, thinking about the branch and the leaves coming off, and just thinking of that long-term impact. Thank you for sharing that.
Tessa, in our talk, we ran out of time to talk about it, but in the disposal realm, we have the permanent boxes, and there's a lot of opportunities. And one thing that I mentioned in my group, that there's a Rotary Action Group. If you have a Rotary Club in your area, and if they're active and engaged, the Rotary Action Group is a national group. And in the state of Ohio, that Rotary Action Group has created a way to use opiate funding to help your community with education, with your schools, with maybe some permanent drop boxes placement. And then in one of the last talks we had was about the Terra bags, and maybe, funding sometimes runs out with that. How do you connect and keep, distributing those and things like that? So, there's different pockets of money out there. Our disposal boxes are permanent ones. We're done through that recycling and waste company. They had little mini grants, a couple thousand here, a couple thousand there. But again, really connect to that Rotary group. It's a Rotary Action Group, but their Rotary group would have to connect to them because it's a more of a national group, and they can help with some opiate funding for different things like permanent drug boxes and then the Terra bags.
Absolutely, and I love that thought of working with other groups who are already pulled together to impact our community. And Rotary groups, while their mission has spanned from physical health concerns to fiscal concerns in communities, they're definitely a wonderful partner, and their purpose is deeply aligned with a community coalition. So I think it's wonderful that they're calling them out specifically. Anyone else want to share some aha moments before I hand it back to our friend Jen here?
There's a nice one in the chat there from Cynthia.
Oh, yes. Cynthia did share there are some interesting ways to continue to stay engaged with older adults, including intergenerational approaches.
Mm.
One nice way I heard today was including a cookbook that includes grandma's recipes with kids. Yeah, definitely like that engagement work. And I think that speaks to, when Dr. Marketa was sharing earlier, some of those, social emotional needs of our older adults. Cooking is a wonderful way to foster collaboration and foster engagement and allows that relationship to flourish. So when you do deliver that evidence-based messaging and you do deliver those evidence-based strategies, you already have that deep relationship. So you can have some of those conversations that are more meaningful. Definitely.
Yeah, I think I'm going to, with that idea, I'm going to reach out to our youth-led group, part of our coalition, and say, hey, why don't you come along to me to the senior center? We're going to give a talk on medication use and disposal and safety. And boy, they'll gobble that up, when they elderly love their grandkids and their kids. And
yes, exactly. And
I love that cross-generational or intergenerational approach. Great thought.
I love that as well. Absolutely. And I see Katie has added, older adults are central to all communities. Their health and well-being must be considered across prevention. Absolutely. Our older adults are vital to our communities. So thank you so much for everyone for your attention and all of your energy today. This was a very fruitful conversation. I love hearing about the collaboration and the idea sharing that's going on. So I'm going to hand this back to Jen because I feel like I could just let us go until 3 o'clock if I wasn't careful. So I'm going to hand this back to Jen. She has a couple of housekeeping items for us.
Yeah, absolutely. So first and foremost, thank you all for joining us today. I just dropped the link to our evaluation for today's session in the chat because the last Thursday of the month falls over a holiday season in November and December. We're going to pause for those 2 months. So those evaluations that you and sharing your thoughts about the format, our speakers, what you'd like to see, why you joined, those are going to be really helpful as we think about what that means for our 2023 lineup of prevention exchange. So really, I think our final thoughts from all of our participants, our panelists, really hit the nail on the head. Prevention's about community, and that's why partnership is the key. It's the keystone of everything we do here at the Center of Excellence. And, we really work to provide that central access point for training, education, technical assistance, and resources. And we do a lot of this programming with input from partners across the state. And that's actually where the idea for this prevention exchange came from. So, we encourage you, please visit our website, take a moment to sign up for our monthly newsletter if you haven't already. We don't sell your emails. This is the only way to actually get access to that newsletter by opting in. So we'll be sharing events, announcements, funding opportunities, and of course, we'd love to connect with you on social media. Prevention is a labor of love. We really want to make sure that we're here to support and amplify the important work that you're all doing so that our entire state and all Ohioans have access to those programs and services that really impact the lives of our friends and family and our neighbors, and ultimately make those communities a better place to live. So thank you so much for joining us. And we hope to see you in January. Please reach out if you have any questions. Our general email address is preventioncoe@ohio.edu. You can find that on our website as well, but we'd love to hear from you.